Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about how long you turn your expanders for. When do you know that you're done? And I have some other, first of all, if you want to know more about expanders, whether it be a fixed expander like this one or a removable expander like this one, they both work great. I have tons of videos on pros and cons, when it's indicated, how many turns you do, how you do turns, how you do the lab slip, you name it. So you can just go into my YouTube channel and search by keyword within my channel for RPE or Schwartz or expander or whatever, and the entire playlist will come. But today we're going to specifically answer the question, how do I know when I'm done turning? And ultimately that's going to depend on what your goals were with the expanders. What were your goals? Were your goals just airway? Were your goals arch development? Were your goals to reduce the likelihood of canine impaction? Were your goals to reduce the likelihood of crowding, to reduce the likelihood of premolar extractions, develop the arches, to reduce the likelihood of needing 2 phases of treatment, etc., 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 right? So many reasons that you can do expanders. They are really miraculous appliances when you use them. I mean, almost all kids can benefit from an expander, and they're such low cost. I really would love to see them implemented in every pediatric office if possible. Just at low cost, just for access to care, because by doing expanders on most kids that need them, at 7 or 8 or 9, you can really reduce the likelihood of needing jaw surgeries later, premolar extractions, and having impacted canine surgeries. So anyway, so I'm all about educating primary care dentists to deliver expanders. So anyways, if you want help with a case, you're welcome to go to StraightSmileSolutions.com, click on services, and schedule an appointment to help review a case. Our fees start as low as $299 per case. Okay, but anyways, I didn't answer the question. But there is no a lot of times I work with doctors and they're like, well, exactly how many turns should I do? And I'm like, I don't know. Depends on how they respond to it. So I recommend that you see the patients either virtually or in person. I prefer in person because there's some things that you really should be checking, especially if it's an older patient. I like you to palpate the roots, feel the bone, all kind of different things. You can definitely do a visit or two virtually, but you should definitely do at least one visit in person, I think. But mostly we're looking at all those factors, seeing how the bite's lining up. We might change the frequency if we're doing upper and lower, etc. But we're mostly looking to make sure that you're getting enough space and then the arches are developed and the bite's fitting together well. And that's pretty much it. So, picture tells 1,000 words is basically what it comes down to. And you don't want to treat to a number. So that's the biggest mistake I hear a lot. Doctors are like, I'm going to treat until the upper arch width is, 40 millimeters or 37 millimeters from mesial palatal cusp of 3 to mesial palatal cusp of 14. No, don't do that. That's a nice guideline, just to help screen cases. I like that arch width thing to screen cases, but in terms of finishing up the case, no. Just do it by eyeballing, and making sure you're hitting goals. And remember, you always want to overexpand a little bit because you're probably going to lose 20 to 30% of what you expanded just in normal settling and relapse. So you don't want to just get there. You want to get there and then a little bit more, if that's important to you. And I always retain my expansion minimum full-time 3 months afterwards, bare minimum. And it depends also if, expanders can be modified to do all kind of cool things, to close open bites, to open closed bites. And so if you're using the expander not only to develop the arches, but to also fix the bite, you might need to wear it a little bit longer to hit those goals. All right. Thanks so much.